background is I have the pleasure of being the president and CEO of COSI, which is really fun. But before that, I trained as a scientist and specifically vaccine development and stuff. And so while I don't have all the answers, I just want to have some open conversation, kind of feel how you all feel about specifically coronavirus, the vaccines, how it's developed. Any questions you have? There are no bad questions. There are no wrong questions. And if I do not know the answer, I'll be like, I don't know the answer. But we can dig in and try to find it. So we have measles vaccines. Right? We were talking about this earlier today. We have measles vaccines, and when you get to measles, you get measles, mumps, rubella. You get all three. In this country, you get it at 12 months of age, then you get it at 18 months of age, and at 5 years, right? We never get another measles vaccine. Right. Anybody catch measles? Any guys catch measles? No?
I have.
You have? Okay. Yeah. So there's two interesting things. If you caught measles as a kid, or whenever, but usually as a kid, you will never, ever, ever, ever catch measles again. That's how strong the immune reaction is to things. So you're protected for life. Those of us who were vaccinated, so you never had measles, right? Did you guys have measles? Yeah, the vaccines. I know that.
I remember.
Yeah. Oh yeah, chickenpox. That's different. Chickenpox is not. Yeah, chickenpox. Okay, that's different. Measles is different. Chickenpox. So we've been vaccinated for measles, and we never had measles. Now think about that. The last time you would have had your measles vaccine was around 5 years old, 4, 5, 6. We're grown men. We don't, right? So this is what people don't understand about this pandemic situation. The vaccine isn't necessarily going to cure and completely eliminate the bad bug from the planet. There's only 2 things we've eliminated, just 2, right? One of them is smallpox, and then there's another one that's polio is almost completely officially gone. That's it. We still have malaria, tuberculosis, we still have measles, we still have mumps, we still have all these things still exist, but they're not a major problem because the vaccines have controlled it. Now get to where you talked about. We're not out of it. Who likes to wear masks? I can't stand wearing masks. I speak for myself. I hate wearing masks. Who likes to have to social distance?
I don't.
Who likes to not be able to go to a restaurant, go to a basketball game with 14,000 people? There's all these things that we hate. Obviously, we don't like people getting sick. Obviously, we don't like people dying. There's all these things that are just, do the responders want to do 2 and 3 and 4 shifts? Because there's all the people in the hospital. Who wants to do that? So there's all these negative things that we hate. And there's only one solution. Well, there's 2 solutions. There's 2 solutions. You eliminate 7.8 billion people from the planet, and we're all dead, and then that's fine. Or we control it. And there's only one way to control it. There's no other secret sauce.
Get the shot.
The good news now that Pfizer came out with a pill, back to your Pfizer company, they came out with a pill that is going to be really good now to help you if you get coronavirus. So that's good news. So if you happen to get it, hopefully this pill will help you. But short of that, it's the vaccine. And that's the only solution. And so for me, for all the people, and I think 3 of you said it, don't just think of yourself.
No.
Think of your loved ones. Think of the people you work with. To your point, it's not just America. Think of the world.
The world.
And the only way we can control this is by as many people as possible being vaccinated. Just like you don't think about measles, just like you don't think about mumps. Hopefully one day we won't think about coronavirus.
Right.
Yeah.
Right.
But that's what it's going to take.